And so at Tufts, we use one system for our medical, dental, and veterinary schools, just one system. Everyone's on the same system. Everyone can see everyone else's content. At CMC, it's one system for their medical school and all of their allied health professions. And so when they're growing some of their programs, they can, there's the small anatomy department, which is teaching all of these allied health. They have their anatomy resources, and they can pick and choose which pieces of the anatomy content is needed for a particular student audience. So all of this work actually started with some early work in East Africa that was run by one of our faculty, Jeff Griffiths, with a Fogarty grant. He was working in public health with the East African Consortium, and they were co-developing content and sharing it. Actually, they were running a course where Tufts students and East African students were enrolled in the same course that was co-developed by both Tufts and East African faculty, and were able to conduct a wonderful dialogue. This is really allowing us to build, wonderful relationships and sharing a lot of terrific knowledge. Tusk is currently at Makerere School of Public Health and also at Muhimbili University in Tanzania. We're also partnering with University of Ghana and Brown University on a new HED USAID grant for HIV/AIDS, human resource and research capacity building. Both David and Richard talked about South-South collaboration, and actually CMC is working, we connected them with OER Africa, and OER Africa is connecting them with institutions in Africa, and they've identified, we'd be interested if you had open materials in X area. And then CMC is working with them to find what materials they have. They're very willing to share content. It's just very exciting to see these kinds of collaborations occurring. And so all of this work actually enabled us to become a key partner in the USAID Respond initiative. This is part of the massive Global Emerging Pandemic Threats Program. We're helping to set up regional training centers around the globe, starting in the Congo Basin. Next will be Southeast Asia, and then potentially the Gangetic Plains and the Amazon Basin. And if you think of each of these areas like the CMC hub and spoke model, so each of these regional centers will be a hub, and then any trainee in the region can access those training materials. And so these centers are to train people who will be both the surveillance and the response teams for the next emerging pandemic threat. And because Tusk uses all open software, it's mobile device agnostic, so anyone can reach the content with any kind of system. So this is my last slide. So what are we doing moving forward? We are creating an open source consortium. So there are several universities in the United States that are using Tusk, several around the world. We're developing a consortium of the technical teams so that they can collaborate to do open source tool development, that everyone can share the tools that are being created. We're starting to work with, we started our talks with University of Indiana, which has developed an open medical record system. They've deployed it in South Africa for millions of patients and HIV/AIDS work and tuberculosis, and they've deployed it now in Kenya. We're talking with them about how to connect OpenMRS with Tusk so that folks in the field who are collecting clinical data can get just-in-time learning modules on their mobile device. And then finally, we are exploring connecting with all the learning management tool systems, Moodle, Sakai, and the last one is Claraline, which many of you may not be familiar with, but it's a French-based open source system. And the reason why we're getting into that is because our work in the Congo, Democratic Republic of Congo, is Francophone. So we are trying to make sure that everything that we do will be able to cross all different institutions. So we're very excited about the growing community that is really getting on board with open source software, materials, content, and just the spirit of collaboration across all these institutions. Just wonderful to see. So thank you very much.